Hey guys, this is Dr. Hub. Today we'll look at the nerve supply in the pelvis. So we begin with the organs, that is the perineum. So the perineum, the vulva and the lower vagina. So these are the structures we are dealing with. So what are the spinal segments here? The spinal segments, it involves the S2 to the 4. So what are the nerves which are involved here? The nerves it involves is the pudendal. So there is presence of the pudendal nerve, and then there is also the presence of the inguinal. So there's pudendal, there is inguinal, there is also the genitofemoral and the posterofemoral cutaneous. There is a posterofemoral cutaneous. Next we move on to the upper vagina. So upper vagina and the cervix, as well as the lower uterine segment. So in terms of this, what is the spinal segment? So spinal segments here is nothing but S2 to S4. So what are the nerves which are involved here? The nerves involved, it is the pelvic. It is nothing but the pelvic parasympathetic. Then we move on to the uterus, the uterine fundus, and the proximal fallopian tubes. The proximal FT, that is the fallopian tubes, as well as the broad ligament. So all this, the spinal segments involved is the T11. So there is T11 to 12 as well as the L1. Now what are the nerves which are involved? The nerves is, there's a sympathetic via the hypogastric plexus. It is sympathetic and it is via the hypogastric plexus. Sympathetic via the hypogastric plexus. Then we look at the outer two-third. The outer two-third, and this is of the fallopian tube. The outer two-third of the fallopian tube is by the T9 and the 10. So what are the nerves which are involved here? The nerves is, there is a sympathetic. The sympathetic via the aortic, and the superior mesenteric plexus and the superior mesenteric plexus. Then we look at the ovaries. The ovaries is by the spinal segment T10 to T11, and the nerves, if you see, it is by the sympathetic. So nerve is by the sympathetic, and this is via the renal and the aortic plexus. So this is by the renal and the aortic plexus. Aortic plexus and the celiac and mesenteric ganglia, and the celiac and mesenteric ganglia.